you all for joining us today for the webinar on the California Health Interviews Survey, or often referred to as CHIS. My name, as many of you know, is Alana Peppinger. I'm the Senior Project Manager for the Champion Provider Fellowship Program, and I'm excited to reconnect with many of you in the new year. So welcome to all the fellows, current and alumni, as well as local health department representatives that have joined us today. If we could go to the next slide, please. So just some general housekeeping that I wanted to keep everybody aware of. As far as being able to enjoy the experience as best as possible, we encourage you to join via your computer audio when possible. Everybody will be kept in muted for the duration of the presentation, and also just suggest putting your Zoom in full screen mode, as we will have a presentation for you to be looking at while we're having this webinar. And then if you have any questions or comments, please go ahead and put them in the chat box. Jessica Davidman will be monitoring the questions and comments and providing any technical assistance. We will be holding all questions for the discussion and Q&A portion following the presentation. And then finally, we will have a recording of the webinar available on the Champion Provider Fellowship website underneath webinars. We anticipate having that posted minimum 1 week from today. Next slide, please. And just a reminder, again, want to point you all to the Champion Provider Fellowship website. There you'll be able to see a multitude of different news about fellows. We'll be able to see updated success stories, but I also wanted to encourage everybody to go to the events page where we have all the events updated for the entire program year. So that's through the end of September 2022. Here I have listed just a couple of the upcoming events. I know some people have been inquiring about the mini college and getting some additional information about logistics for that. We will be sending out some information next week. And I just wanted to also mention that the webinars, as well as the mini colleges, are available to all fellows, again. So whether you're in the current cohort 4, or your alumni, you're welcome to attend, and that also includes all the local health department representatives as well. Next slide, please. So I am thrilled to present today's speaker, Todd Hughes. Todd is the director of the California Health Interviews Survey, again, as we mentioned, CHIS, at the University of California, Los Angeles Center for Health Policy Research. The CHIS is the nation's largest ongoing state health survey, and it provides a detailed picture of the health and healthcare needs of California's large and diverse population. In his role as director, Todd oversees all operations of the CHIS, including sample design, questionnaire development, data collection, data dissemination, and management of all project deliverables. Prior to his current role, he has expertise in survey research during 20 years of federal service at the U.S. Census Bureau, which included serving as Assistant Division Chief of the American Community Survey, where he directed the survey's operations. Jessica, if we can get, okay, where he directed the survey operations, which included collecting data from 3.5 million households each year. Todd holds a master's certificate in project management from the George Washington University School of Business and Public Management, and a Bachelor of Science in Statistics from Brigham Young University. So following today's presentation, we hope that you all will feel more comfortable navigating the CHIS data set and understand really how it could be leveraged to communicate with key decision makers in your community. This webinar was kind of prompted from I think one of the other things that we were hoping to bring to you today in today's presentation was an overview of, kind of the past year and impact that COVID has had on some of the areas that you all are working in and of our interest. So with that, I think I will go ahead and turn it over to Todd to present today's webinar.
Thank you very much, Alana. And I will share my screen here so you can see slides. Okay, just to confirm, can you see that okay?
Yes, we can see that. Thank you.
Okay, fantastic. All right, well, it's my pleasure to be here speaking to the Champion Provider Fellowship Programs folks to share a little bit of information about the California Health Interview Survey and how it can be leveraged as a tool for you in your efforts. As an overview of what I'll cover today, we'll start with an overview of what the California Health Interview Survey, or CHIS, is and how it collects its data and what its mission is. Then we'll share a bit of a tutorial about some of the CHIS data dissemination tools, specifically how to use the Ask CHIS system to access the various CHIS data. And then after that, I'll share some highlights that we saw in our release of the 2020 survey data that might be of interest for you, and some infographics that may be useful to you as you examine the impact of pandemic in various components of health behaviors and access to care. And then we'll leave some time at the end for some discussion and Q&A. So what is the CHIS? It is the nation's largest ongoing state health survey. And it really is an invaluable and comprehensive source of information about numerous components of health for the diverse population of California. And it includes topics from current health status and health conditions to mental health, oral health, various behaviors that contribute to health, and then many questions and topics about access and use of healthcare, including health insurance, and then many different socioeconomic and demographic components, such as employment or other responding characteristics that are essential to really look at being able to analyze the data effectively. So how is the CHIS conducted? Well, we begin by selecting a random sample of addresses across the state. And within each of those addresses, we select one adult at random to participate. And then potentially, if that adult is the parent of an adolescent or a child, we will also collect data about any one adolescent in the household and one child age 0 to 11 if present. And we do that through the process of a screener interview. Then we determine who the sample adult is, and if they are the parent of the child, we begin through parent proxy to collect information about the child first, and then we do the sample adult interview. And then separately, with the parent's permission, we conduct an interview directly with the sample adolescent. We do this in a number of different languages to support California's diverse population, and those are listed on at the bottom of this slide. In 2019, we implemented a new design for the California Health Interview Survey. Historically, the CHIS had been a random digit dial telephone interview data collection operation. But starting in 2019, we implemented the methods that are outlined on this screen, which involves address-based sampling with two phases of collection, first being a push to respond by web, and then second to be telephone non-response follow-up. So we begin by mailing up to 4 separate mail pieces to each sample address. And in those mail pieces, we invite one sample adult with the next birthday to respond to the survey, ideally to go online and conduct the survey by web, or to call in by phone if desired. After those 4 attempts by mail, if we haven't yet completed the survey, and if we're able to match a telephone number to the address, we make outbound telephone attempts to try to conduct the survey. This shows some summary of information about 2020 data collection. Specifically, we conducted almost 22,000 adult interviews in 2020, 1,300 plus adolescent interviews, and over 3,500 surveys were completed for children age 0 to 11. And you can see here the different racial and ethnicities of the racial backgrounds and ethnicities of those who completed the study by those different survey types. So it is a pretty diverse data set, and we do pride ourselves on truly trying to represent the state's population well. In 2020, as the pandemic was becoming the issue that it was, we realized that we needed to pivot, and instead of an annual data release of CHIS survey data, we developed multiple dashboards that could be useful in real time during the pandemic. So specifically, for both 2021 and 2020, we created a dashboard of preliminary monthly estimates, which uses new survey questions that were added specifically in connection with the COVID-19 pandemic to present those data. We also had other dashboards that used historical CHIS data for different risk factors and health conditions and mapped that to county level data about the pandemic to be of use in that way. And then finally, we partnered with a new NHPI data policy lab to create a dashboard connected to the needs of our Native Hawaiian and Pacific Islander population. More broadly, though, CHIS data are released through a number of different mechanisms and tools. For power users, these purple options are available: secure network access through our data access center, where we can analyze the data in great detail for you for a fee, or public use files, which can be downloaded if you have statistical prowess and want to analyze them yourself. But these orange components here, Ask CHIS Neighborhood Edition, including Ask CHIS Neighborhood Edition on Espanol, and health profiles are really designed to be user-friendly to anyone with any level of statistical expertise to be able to query the data systems in ways that really meet your needs. Before I talk about how we can release those data in more detail, I want to make sure you understand some information about the sample design for the survey. We do collect data for most counties individually, although there are 3 groups of county strata that contain the 17 smallest counties, as identified here on the map. And those for those counties, we're not able to produce direct estimates for each individual county, but you can look at the data for that group, for each of those 3 groups. For 2 of the counties, we actually go below the county level. Los Angeles County and San Diego County, we do down to the service planning area or the health region. And then the remaining 39 counties each form their own individual strata. Now, we do produce through our Ask CHIS Neighborhood Edition estimates that are modeled estimates down to low levels of geography. So for those direct estimates corresponding to our sample strata, in our Ask CHIS system, we produce statewide estimates as well as essentially county level estimates for those 56 sampling strata. That contains the 2020 data that was released last fall. But if you do want to get down to assembly member districts, Senate or congressional districts, or down to cities, zip codes, and even census tracts, we do produce modeled estimates in the Ask CHIS Neighborhood Edition platform. And that's updated every 2 years, and the 2019-2020 data will be released in mid-2022, so keep an eye out for that later this year. And this is just a quick snapshot of what the Ask CHIS Neighborhood Edition tools can really provide. You're able to search for individual locations, combine locations, select census tracts, combine census tracts, make your own kind of custom geographic areas to get survey estimates for. And then you can see once you've selected your interest, your area of interest, you can then output data for some of the key characteristics that are collected in the survey, and as well as presented visually on the map. So it's a very useful tool. However, today I'm going to focus on the tool that's a little bit simpler to use, but much more powerful as well, in that it allows us to look at all of the indicators on the survey, and that's the Ask CHIS platform. So you can access this system at ask.chis.ucla.edu. It's a free account that you create there. And then it goes through multiple steps to have you create custom data tables that really meet your needs. So sequentially, I'll show you how you can use it to select geographic areas, then the specific topics of interest, and then you have optional enhancements to compare across topics or to limit the population included in a given table for that geographic area. And then how you can select 1 or more years and use those to either look at trends or look at pooling across years to get more power for smaller population groups or smaller geographic areas. So first, as you start the process in the system, it'll ask you to select a geographic area of interest. You can certainly choose all of California if that's your interest, or you can click on the Counties and Regions tab and pick individual counties. I'm highlighting here how to use the Los Angeles County Service Planning Areas tab, where here I have selected the South Service Planning Area in LA County to give you an example, as we'll go through the following slides. You can also select individual San Diego County health regions here as well. And when you've selected your geographic areas, you click on Next, and then it will lead you to select a topic. So as you select a topic, you can either click on the search tab and just type in a topic and see what related topics come up for you to pick your category. Or you can choose from the list of groupings here. And then as you pick on a broad category, so here I've picked on oral health, I've selected oral health. It gives you the potential for additional subcategories. In this case, it's just the oral health that's presented. But then it shows you multiple indicators based on survey questions that you can create data tables for. So in this instance, I've selected time since last visit. I can see here based on the age group that this was a question asked of adults and in which years it was asked. So I have the option to trend or pool across those years. And then it shows me what the results will be displayed for in these categories. Next, it'll ask if you would like to select a comparison topic. So if I want to look at the time since last dental visit crossed by poverty level, for example, I will go here and click on demographics as my category, and then within demographics, select income and poverty. And then I choose poverty level here as my indicator of interest, and it shows me which age groups that's collected for and which years, et cetera, and what the categories are that are used in this indicator. So I'll select poverty level here, and then it allows me to select limiting populations. So here I have the option to reduce it to certain age ranges or genders. In this case, I've selected certain racial ethnic groups. So I've selected everything other than white non-Latinos. And I'm keeping all of the federal poverty level ranges in this analysis. Now, as you work in the system, there will be times where you may receive this pop-up that tells you that the table that you're about to produce has some statistical instability, and it gives you some options for ways to address that. The most common way to address it is by pooling years. So, aggregating data collected over multiple years to give you a more robust set of data to produce the estimate. Or you could collapse the topics, reduce the number of categories that you'd be including to try to increase the sample size within each of those cells. So in this case, as I go into the years selection, I'm actually going to select 2 years, 2019 and 2020, and I'm going to pool those years to increase the sample robustness for my estimates. So I've selected all of my different desired characteristics, and now I just click on Get Data or Next, and I will receive a data table that shows me time since last dental visit crossed by poverty level, and this is within the LA spa, the South spa that I selected, and for the racial ethnic groups that I selected. And so it includes both row and column totals to help you analyze the data as well. So you also have the option, aside from a table, to look at this. So that's what would show up in this data tab. But if you click on Charts tab, you have the option to select a bar chart or a pie chart if that helps you analyze and understand the data more clearly. Or you could click on Trends if we had multiple years that were not pooled, but instead we're comparing for trending. So these are built into the system. You also have the option to export the data for this table into Excel. So this is an example of what would happen if I exported those data. And you can see it provides similar information. It includes the 95% confidence intervals as well as the population estimates. It cites when it was created and the specific categories that were included and any of the geographic selections that you had chosen. So it's a very straightforward process. If this demonstration was just a taste and you'd like a little bit more training on how to use the system, I encourage you to go to chis.ucla.edu/CHIS training. That includes our on-demand learning library where multiple videos are available. They're free, they're fast, they're about 10 minutes long. They're really designed for people who have no experience using the system. They're available 24/7. And they can talk you through for both Ask CHIS and Ask CHIS Neighborhood Edition, how to do some basic queries, present the data, export your data, and a little bit of basics about statistics, confidence intervals, stability, etc. So definitely encourage you to explore those videos if you'd like. Okay, next I'd like to transition to what some of the data highlights were from the 2020 CHIS. All these data you can actually identify in the Ask CHIS system yourself, and you can slice and dice these data a little differently if you'd like to look at a specific geographic area yourself or for a certain subpopulation group. So just these were broad highlights that we wanted to share with you. All right, so in the 2020 CHIS, we asked adults a number of questions related to the coronavirus pandemic, including questions on whether they ever had or thought they had COVID-19, whether they would plan to receive a COVID vaccine if and when becomes available to them, and whether they continue to report to work during the stay-at-home orders because they were an essential worker. Looking at the data for these questions, we observed a higher rate among essential workers of those whoever had or thought they had COVID-19, 15.1% versus 12.1% for other adults. Somewhat surprisingly, though, we saw that these essential workers were somewhat less willing in 2020 than other adults to plan to receive the vaccine when it became available to them, 73.6% versus 76.7%. This next slide highlights some ways that CHIS data reflect changes regarding smoking and tobacco-related issues during 2020 and may have been influenced by reductions in social contact during the pandemic. As you might expect, with many people staying at home or working remotely, the percentage of adults reporting exposure in the previous 2 weeks to secondhand smoke from tobacco products or e-cigarette vapor dropped significantly in 2020 to 26.6%, which is basically half the rate from 2018, and a significant drop from 2019 as well. We also observed statistically significant reductions in the rates of flavored tobacco use in the past 30 days for adults, dropping from 5.8% in 2019 to 4% in 2020. And adult e-cigarette use in the past 30 days also dropped from 4% in 2019 to 2.8% in 2020. Next is some information about dental insurance coverage and time since last dental visit. We did observe a slight but statistically significant increase in the rates of those covered by dental insurance from 2019 to 2020, rising from 68.1% to 70.4%. And perhaps not surprisingly, and some of you experienced this firsthand, the time since last dental visit did significantly increase from 2019 to 2020, looking at both adults and teens. So for those who had gone more than a year or had never, or say they had never visited a dentist, that rate rose from 30.3% in 2019 to 32.8% in 2020. And for teens, that rose from 6.6% in 2019 to 11.1% in 2020. The survey does ask a question about overall condition of their teeth. It's a self-reporting question where they can select from excellent, very good, good, fair, or poor. And this slide presents information about the percentage of those who selected fair or poor as their response for their condition of the teeth, broken down by racial group. And as you can see, the proportion of Asian, Latino, and Black adults who reported only fair or poor condition for their teeth was significantly higher than among the white adults at 19% versus 26 and up to 32% for the other groups. Next, I'd like to share some findings from the survey about obesity rates by race, ethnicity, and by poverty level. As you can see here, the proportion of those who, based on their reported weight and height, who would be classified as overweight or obese in the population is significantly higher among Latino and Black adults than white and Asian adults. And so the benefit of having this on the surveys, you can look at this then by certain geographic areas, by certain subgroups, by age ranges, et cetera. So I encourage you to explore these data further. One of the ways that I've highlighted this on the slide is also by poverty level. So those who classify as overweight or obese was higher among those in the 0 to just under 200% of the federal poverty levels. So 68.3% classified as overweight or obese, compared to 59.4% of those who were at least twice the FPL or above. In 2020, we all understood that stay-at-home orders were likely to have significant impacts on youth in California. The CHIS captured several changes in health-related behaviors for adolescents. Some were positive and some were less positive. Focusing first on some healthy changes, we did observe significant reductions in binge drinking during the past month for adolescents aged 12 through 17. Dropping from 7% in 2019 to 2.6% in 2020. And also with more time at home last year, we identified a significant increase in adolescents reporting that they were eating 5 or more servings of fruit and vegetables each day, which rose from 26.1% in 2019 to 33.3% in 2020. Unfortunately, though, not all the behavioral changes for young people were healthy during 2020 stay-at-home orders, including changes to physical activity and internet use. The CHIS asks about the time that children ages and adolescents aged 2 to 17 spend on typical weekend days, participating in sedentary activities, such as sitting and watching TV, playing video games or computer games, or talking to friends. We observed a significant increase in the amount of weekend sedentary time in 2020. 40.8% of youth reported spending 5 or more hours per day in 2020 versus 35.4% in 2019. And then among adolescents aged 12 through 17, we also identified more than a 50% increase in 2020 for those who reported being on the internet almost constantly each day, rising from 28.6% in 2019 to 43.2% in 2020. In the 2020 CHIS, we also asked adults whether they had experienced any unfair treatment because of their race or ethnicity. Overall, 1.9% of adults reported this. But as you might expect, given increases in hate incidents reported among Asians during the pandemic, and the racial injustice protests that occurred after the killing of George Floyd in May 2020, the rates of unfair treatment were not equal for all race groups. Specifically, Black adults reported the highest rates of unfair treatment due to race during 2020 at 6.4%, followed by Asian adults at 4.2%. White adults had the lowest rate of reported unfair treatment, followed by Latinos and 2 or more races. We did not have sufficient data to be able to release stable estimates for American Indians, Alaska Natives, Native Hawaiians, and Pacific Islanders. So next, we considered the mental health impacts of those that had experienced unfair treatment due to their race or ethnicity. Rates of those that had ever seriously thought about suicide and rates of those experiencing serious psychological distress in the past year were both significantly higher for those adults who reported being treated unfairly because of their race or ethnicity. 19.3% of those who reported unfair treatment due to race or ethnicity had experienced suicidal thoughts, compared to 12.1% of adults that had not experienced unfair treatment. Similarly, 18.5% of adults experiencing unfair treatment due to race or ethnicity experienced serious psychological distress in the past year, compared to 12.1% of other adults. The 2020 CHIS questionnaire also included a question about whether the respondent experienced an increase in interpersonal conflict in their household during the pandemic. We compared these responses to other survey questions that captured the economic impact of the pandemic, specifically whether the household had difficulty paying for basic necessities such as paying bills, tuition, or affording groceries, as well as whether the respondent reported losing a job during the pandemic. We observed a statistically significant higher rate of interpersonal conflict within those households that experienced these significant economic challenges. 22.9% of households reporting difficulty paying for basic necessities during the pandemic also reported an increase in interpersonal conflict, almost twice the rate of households with no difficulty paying for necessities. Similarly, 19.3% of households where the adult respondent lost a job during the pandemic experienced increases in interpersonal conflict, compared to 13.9% of households where the surveyed adult did not lose a job. Next, I'd like to share some information from the survey about doctor visit and routine checkups. We do ask about these visits, and we ask if they received such a visit in the past 12 months. And as you might expect, similar to as we saw with last time since a dental visit, we did observe a significant drop in those, the percentage of California adults who had a preventive visit in the past 12 months during 2020. Specifically, that dropped to 67.9% in 2020 compared to 71.1% in 2019. This was actually the lowest estimate that we've had since the implementation of the Affordable Care Act in 2013. You may be wondering whether COVID-19 specifically was the barrier to individuals receiving the medical care that they needed. We do ask for the various reasons that did contribute to individuals not receiving care, whether it be not having a preventive visit in the past 12 months or other necessary medical care. And we found that the percentage of those who cited COVID-19 as one of their reasons for foregoing care did vary by age group. Across all ages, 21.6%, so more than 1 in 5 Californians who did delay or forego medical care cited COVID-19 as the main reason for delaying their care. But that varied significantly by age group. As you can see, for older adults age 65 plus, they were almost 2.5 times more likely than the adults age 18 to 64 to delay or forego their care, with 44.2% of older adults reporting that COVID-19 was the main reason. However, cost continues to be a significant barrier. Cost of medical care and lack of insurance continue to be major barriers to accessing care. So the table presented on this slide highlights different main reasons cited for delaying or foregoing necessary medical care, crossed by racial ethnic groups for 2020. And as you can see across each of the racial ethnic groups, cost, lack of insurance, or other insurance-related reasons was the top reason cited. COVID-19 is also presented here in the slide, but it's especially noteworthy here among the Latino group, where 40% of Latinos in California cited cost, lack of insurance, and other insurance-related issues as the main reason for delaying or foregoing necessary care, compared to only 28% of white people. The one exception to cost being the top reason is in the 2 or more races category, where statistically it's quite close to those who cite healthcare system provider issues and barriers as their main reason. All right, and the final data highlight that I'll share from the 2020 CHIS has to do with some chronic conditions crossed by income. So in general, we saw that adults with greater poverty were more likely to be diagnosed with certain chronic conditions. And here we explore diabetes and high blood pressure. So among those diagnosed with diabetes, 14.6% were less than twice the federal poverty level for income, compared to 9.4% of those with at least 2 times the federal poverty level of income being diagnosed with diabetes. And a similar direction for high blood pressure. This excludes those who've been identified as borderline high blood pressure. We saw 28% of those with less than 200% of the FPL being diagnosed with high blood pressure, compared to 23.9% of those with higher incomes. I will put our final link here to our website, chis.ucla.edu, for more information about the survey, or you're also welcome to email me at toddhughes@ucla.edu. But otherwise, I'll turn it back to Alana to navigate some Q&A.
Fabulous. Thank you so much, Todd, for all that fantastic information. I think it's so great to get, first and foremost, a foundation and understanding the CHIS database, just how you all do the collection, understanding some of the great data that you all collect in that survey. So, and then also just understanding that, one of the great assets about it is you can get some of that very hyper localized information, which I know for the fellows who are working in counties and even for local health departments, that's so vital to have access to that information, especially when they're going to talk with key decision makers and policy leaders in their community. So I do want to encourage everyone that's on the line, if you do have any questions, please go ahead and drop them in the chat box. But in the meantime, I think I'll go ahead and just ask a question that I have off the top of my head, Todd. I was hoping you could just kind of maybe provide some very high yield tips for doing searches.
Yeah, I think the first thing I would recommend that you do is you're doing searches and using the Ask CHIS system, and let me back up in the slide deck, is really familiarize yourself with the list of topics that are available, and just kind of explore what those topics are. So here, for example, in selecting a topic, you can pick a category. And if you click on each of those categories and then each of the subcategories, you'll see on the right, you can scroll through, numerous possible indicators, different topics that you may be interested in. So I would start by getting a little familiar with what's available. And then as you saw here, and then you can start to get those creative juices flowing a little bit about what things you might want to cross with each other. So the system really allows you maximum flexibility to be able to do that. I mean, I showed an example just by income and poverty, but even just among the demographic variables, there's so many you can choose from, not to mention crossing it by other health conditions or health behaviors or access to care or health insurance. So I would start by just getting a little bit familiar with what is available in the data set through each of these categories. And then it's really a matter of, running some tables, seeing what the data tell you, and exploring, what questions are you feel that you could answer, or maybe additional questions that additional categories or queries might help to answer.
Great, thank you so much. And I know that for those that were following, there was a lot of really fantastic information that was presented as it related to kind of the highlights of the data of 2020. And I know one of the reasons we had explored having this presentation with you, Todd, is that, initially we were getting, because we had the benefit of working with local health departments and physicians and dentists who are seeing individuals coming, just there's a lot of anecdotal data that was starting to develop as far as some of the changes they were seeing with their patient populations as it relates to increases in obesity. And then, started to see also some studies that were coming out within different health systems, looking at some of those changes and many of the factors that we look at. But I think what's so valuable about the CHIS, data set is we're actually now start to get some, a little bit more broader data that, again, can look whether that's more within our own communities or, just at the state level and provide some comparisons there. So, some really great information. I was wondering if you could just maybe provide a high level view of, above and beyond maybe what you presented. Is there anything else that you and your team that surprised you about the 2020 data? I know you developed something very comprehensive, but I just wondered if you had any other highlights that maybe even especially pertaining to this group, as we're focused on implementing policy systems and environmental change interventions related to obesity, chronic disease, and dental disease as well.
Yeah, no, it's impossible for me as the director of the survey to to be able to retain highlights from all the various topics that are on the survey. The survey itself in 2020, well, this year 2021. that we just finished, the survey itself was over an hour long. So there really are hundreds and hundreds of questions. And so, our role is to really democratize access to the data, and allow the users to find those highlights for yourself. There are certainly, as I shared in the infographics and slides that I presented, we pick a few just to highlight during our promotion of the annual data release. And we certainly do work with the various researchers or other organizations who'd like to fund a more detailed dive into what the survey data say on a given topic. And we do release a number of policy briefs or fact sheets or other reports that really, look in detail on certain topics. And those are posted on the Center for Health Policy website as well. Or, just go to the chis.ucla.edu link, and you'll see up at the top, publications and recent publications, and you can see a number of what those are. Truly it's, and I just wanted to go back to, you hear anecdotal evidence about, things that you're experiencing firsthand. You've really got the tools here now to look at it. Maybe you just want to look at the most recent 2020 data because you're trying to emphasize what's happened during the pandemic. That'll require that you use the Ask CHIS system, and you're only going to be able to go down to the county level for that. However, in mid 2022, just a few more months, you'll be able to really look at those data down to the census tract level. I mean, currently we have 2017, 2018 survey data available in the system. So if you're just looking for something that says this area, this neighborhood, if you're looking for evidence to say this neighborhood has a bigger issue with a certain issue than the neighborhood next to it, and it's okay that you think that that's a long-term impact and can use the 2017, 2018 data, I encourage you to use the neighborhood edition tool now to be able to pull out those data and look at it. But if it's something that's more recent, especially things influenced by the pandemic, I encourage you to wait a few more months until those 2019, 2020 data are released in the system.
Great, thank you so much. Looks like we just from one of our from Sylvia down in Ventura again, Todd, which I know is your county area. Just wanted to say that the presentation was very helpful, and CHIS is just such an indispensable resource, which I very much agree. I'm curious, maybe to some of either the fellows or local health departments that are on the call. Maybe if you can reflect on, just for other people who may be new to this resource, how you have utilized it in some of your own work. I think that may be helpful for others to hear. So if anybody on the call has utilized it and maybe can share how they've worked with the CHIS data in moving forward different policy efforts, whatever it may be. If you could raise your hand or and we can unmute you, that would be great. Sylvia, I may call on you since you since you mentioned familiarity with the resource.
Hi everyone, how is everyone doing?
Doing well, thank you.
Well, I've used it to gather data when we are writing an application for a grant. Also to inform the work that we do with the CalFresh Healthy Living program, as well as other programming that we have with our chronic disease prevention program. We looked at that data to inform and how we're going to plan and how we're going to proceed with interventions, at the community level.
Great, thank you.
Fantastic.
And thank you. The information is great. And I'm just so excited with all of the new tools that I've seen, because I haven't visited in some time, I think during the pandemic, but I was so excited to see all of the new tools. Thank you so much for the work that you do.
You're very welcome. Glad the data are being used.
Anybody else want to comment and maybe how they've utilized it and whether or not they've actually been able to work with some of the data in presentations that they may have provided to, whether it's school boards or other, key decision makers in their community? And if you want to raise your hand, that would be great. All right. Well, I think this is definitely, I think, even for myself, Todd, I know this is a resource that I am familiar with, but it was just so great to kind of get reacquainted with it and also understand just, how to do some of those queries again. I know it's a valuable resource that I've utilized in the past, and I really thank you for providing all this information. Again, I know probably people were very intrigued by all the highlights that were provided, and I just want to reiterate that this presentation has been recorded, so we will make sure to get that posted on the website. In addition, Todd has generously allowed us to post his slides as well, so those will be available for your review. And hopefully, I would encourage a lot of you to, I know there's many of you that are working in various different areas, whether that's looking at, sugar sweetened beverage consumption. There's definitely questions related to or queries around that you can do, and a whole host of other areas that I know many of you are focused on at the current moment. So I would encourage you following this presentation to take a deep dive into the Ask Chiz. Go ahead, if you don't have an account, create an account and just, kind of come up with a general question of interest that you have, maybe based off of some of the, again, kind of experience that you've been having in your clinic, and kind of see whether or not you can find some data that may provide a little bit more insight to, why you may be seeing increased rates in overweight, obesity. What are some of the health behaviors that are potentially contributing to that? So I think, Todd, we may be ending a little bit early today if there aren't additional questions, but I just wanted to again extend my gratitude for you presenting today and providing all this fantastic resource. And again, I know that there's some fellows and other individuals that indicated they weren't able to make it today, but definitely want to have a copy of the recording. So we'll make that available. And then, also to all the fellows and local health department representatives, thank you for joining us. This is our first kind of day back, I guess, as far as all of us kind of getting together online since the start of the new year. So I appreciate you all being able to join us. I understand that for many of you it's difficult, challenging times, staffing issues, of course. So I appreciate everybody making the effort to join us. And with that, I think we'll end a little bit early.
Great. Thank you, Alana, and thanks everyone for taking time to listen today.
Fabulous. Well, have a great rest of your day, everybody.
Bye-bye.
Bye.